Any questions or comments? Any questions for more attendees?
Dr. Bambury?
Yes, hi.
Hi, Shulian here. We have received one by email, a question. I'll read it to you. I've also sent it to you by email as well.
Yes.
The person is saying that is a 56-year-old PMB, menopause at 51, menarche at 10 years old. Yes, I think less than 5, had spotting 3 times in the month, no vaginal dryness, some H/O local estrogen glasses, previously for dryness, no PR bleeding, no DM, P1, normal BMI, strong family history of breast cancer. My concern in doing her scan was the presence of 2 well-defined hyperchoic lesions in the myometrium. The lesions were completely white. They didn't look like the usual calcified fibroid. I was wondering if you have ever seen that before. She's for a pipeline, sorry.
You want to take that on, Dr. Guthrie?
Yes, the white lesion in the myometrium is not really endometrial cancer. There could be small calcified fibroids, things like that. However, if the person is spotted, I would still recommend that they do their sampling at least with an office procedure, a sample endometrium. Now, the age of the person was what?
51 years old.
56.
Sorry, 56, yes, 56.
Because at 51, she could still be menstruating regularly. But spotting after the menopause, it still needs proper investigation. And the people like to treat ultrasounds. I mean, we doctors like to treat patients. And so as a result, if an ultrasound shows little white spots in the myometrium, they are likely to be just little calcified fibroids and nothing else. And not because you see fibroids in postmenopausal women, that doesn't have anything usually to do with their postmenopausal bleeding and endometrial cancer.
Did she say that the patient had endometrial biopsy performed?
I'm not seeing that now.
Okay.
Okay.
And she said about the ultrasound, the endometrium was not thick. It was the little white spots in the myometrium, which is in the muscle. So normal to me, but if she's bleeding, she needs the biopsy.
Okay. Now, there are 4 other questions I'm seeing here. It says, after trachelectomy, if a 2nd trimester miscarriage occurs, how is it managed? Is a hysterectomy needed?
Dr. Taylor? You're on mute, Dr. Taylor. Matthew, you're on mute.
Oh, sorry. Yes, I was trying to answer. All right. If it's early in the 2nd trimester, you can still dilate them and do a suction curettage on them. If it is large, then yes, you have no choice but to do a hysterectomy.
They can try to get pregnant again.
Yes.
Yes.
Yes. You have another question there?
Yes,
Julia?
there is. Yes, Doc. Good morning, Dr. Bambury. Can you please enlighten on HPV typing availability in Jamaica?
Yes, HPV typing is actually available in Jamaica, and we have been doing that through Carigen, which is on the university campus. So what they will do is they have a panel of screening. So they will do the HPV typing for the low risk types and the HPV typing for the high risk types. Now, if you want to individualize in terms of recognizing what type specific HPV, then that's a different test. But they can tell you whether or not the patient has a high risk type or a low risk type of HPV. And those are they're placed into groups. So it is available.
Good.
And we have been doing a couple of those as well.
For a long time too.
Yes.
The other question is, what age should women stop doing pap smears outside of occurrence of cancer? And the question is, can the persons do it at age 85?
So if a patient, and the recommendation is if a patient has had 2 consecutive normal smears prior to age 65, then they can stop doing pap smears. If they've had previous abnormalities, then you may have to continue their screening up until later on.
Okay. Well, Doc, I'm not seeing any more questions at this time. I'm not sure.
There's one. Can a woman of 59 years get the HPV vaccination?
I'm going to ask my well-learned Dr. Guthrie, what do you think of that question?
All right, this is something that has evolved over the years.
Yes.
At first, it was stated that you should have vaccines as 10, 11, 12 in that age group, and it was largely based on the fact that you haven't started to have sex as yet, number one, and number two, that children tend to have a more robust response to vaccines, whichever vaccine it is. But over the years, it has been shown that anybody at any age can get HPV vaccine with some benefits, although the benefits get less and less and less. So you can.
Yes, for sure. I mean, the immune response after a certain age is not going to be as robust as in the younger age group. And patients need to recognize that, but for sure. And initially when the vaccines came out, they were only distributed for certain age group, but now the studies are showing that older age group can actually get the vaccine, but they need to recognize that because of the lowered immune system, it may not be as robust, but there is some benefits.
Okay, Doc. I'm not seeing any more questions.
Everybody should get HPV vaccine. Maybe men too, because they're penile and anorectal and throat cancers and all these things.
Yeah.
Somebody has their hand up.
Go ahead. Can the host allow them to speak?
Andrea McIndoe, you're allowed to speak. Can you go ahead?
Or
Mike for us. And
her mic is still on mute.
Please unmute her mic.
Okay, can you hear me?
Yes, go ahead, Andrea.
Good morning, good morning, everyone. I'm a member of the Jamaica Cancer Society. Breast cancer runs in my family. My mother died at age 49, and my 2 aunts, paternal and maternal, my cousin has it, my sister has it. She's in remission. Well, I'm afraid to go and get my mammograms done, so I'm overdue a mammogram, but the presentations today were excellent. Now, I've been doing the pap smears constantly, but what I'm finding is that our doctors, most of them won't call us back to tell us the results. And sometimes when we call, they can't find the result. You know, so sometimes I don't know what to do. I'm 59 years old now. I was the one that asked about the vaccine, and I have comorbid conditions, so I'm not even sure if it would still help. And the menopause has totally upset my hormones, you know. But I'm saying I've been encouraging my colleagues and co-workers as I retire from the teaching profession next week to do their pap smears, because many are afraid, doctors, to do their pap smears. I have co-workers in their 30s, I don't want to take up your time, but who have never done a pap smear. Middle 30s, early 40s, they're just afraid. But I encourage them to do their pap smears because they're sexually active and need to you know, do their pap smears, but they are so afraid because they have heard how pap smears are painful, and they say, Mackie, they call me Mackie, Mackie, I'm so afraid to go and get it done. So I want to thank you, doctors, and I will call my doctor for my result. I've been calling and calling and cannot get the result of my pap smear from last year. Thank you so much, doctors.
Thanks for your comments and question, Andrew. So as it relates to your colleagues, encouraging them to get their pap smear, I think that's important. And what the studies have shown is that majority of cervical cancer occurring patients who have never had or who are poorly screened or in the under-screened population. So I think it's good that you're advocating that you get your colleagues and friends get their pap smears done. And of course, talk to your doctor and getting your results to ensure that all is well.
Yes, go ahead, Dr.
Guthrie.
Yes, just to add a little Jamaican flavor. And that patient was very intelligent, and I can understand her concerns. But there's a saying that if you have cow skin, you must look at water. So if you do your pap smear,
yes,
I mean, you must check and go back for the result. So if you are so scared about breast cancer with such a strong family history, you can remove the breast. You don't have to keep them. I mean, it sounds very drastic, but believe me, it's 45 years of practicing. And I have many ladies who nothing was wrong with their breasts, but they had strong family history and they did prophylactic mastectomy. And it is getting more and more common since Angelina Jolie. But it was people doing it here a long time before Angelina Jolie. But it's just that we don't publicize these things.
Shanika South, you have a question? Shanika, just unmute your mic.
Sorry, apologies. No questions.
Okay.
I see some questions in the queue. In light of the Kingston-centric national screening programs, is there any eminent thrust to expand beyond this? In other words, rural. Julian, you want to take that?
Well, sir, just to answer that question, we do have screenings outside of Kingston and St. Andrew. St. Anne is quite active screening that side of the island as well. We have partners at Cornwall Regional Hospital with whom we have screening as well. And the general focus of the Cancer Society, especially even with Kingston, is that we have a complete cervical cancer screening program, which takes us across the length and breadth of Jamaica to conduct screening. So, and we also have our partners that have regular and once a year medical symposia to discuss cervical cancer, including articles in the print every April on Cervical Cancer Awareness Month. So I think the Jamaica Cancer Society is quite dynamic. We do television interviews, we do radio interviews speaking to the entire island about cervical cancer. And
you remember the late Ropers, they really did a good job in St. Elizabeth and Manchester.
Yes, absolutely. Yes. The next one is most doctors ask patients to do a pap smear every year at a well
woman visit. Is so regularly recommended.
Yeah. In other words, should you do a pap smear once a year?
Dr. Taylor?
All right, so most places overseas will recommend doing a pap smear every 3 to 5 years. And the reason for that is primarily the pickup for every year doesn't really increase that much. All right, but these are places that have well-established screening programs. The patients are very diligent. They come in and they're doing the pap smears. In a country like Jamaica, we have a lot of other issues. We don't do the pap smears. We don't have a national screening program, so we're not really doing that many pap smears. By and large, we're not really auditing the results very well neither, in terms of are we looking at the results. They go to different labs, they come back. The labs may never know the results, the ultimate outcome of that patient and what happened to the patient. And then sometimes the results, especially in the public sector, takes a very long time to come back. 6 months to up to 6 months. So I don't think we can apply what happens in a developing country necessarily to Jamaica. If Jamaica had a national system of screening, I would say yes, every 3 years, doing the extra pap smears on a woman in the wider population is going to cost a lot for the government, and it wouldn't really pick up a lot more cervical cancers. But for the individual woman, where you're looking at the patient on an individual basis, if she's prepared to do it, and she's comfortable with doing it, I would say every year. If it poses a problem for her, then she can drop it to every 3 years. I mean, as already shown in the presentations, we have HPV screening out here, and with the use of HPV screen and the pap smear, we can even extend the time to do a pap smear to every 5 years, all right? Rather than every year as we're doing here now. I mean, HPV testing is a bit more expensive, a bit more difficult to get access to at the moment. But perhaps in years to come, we'll be doing it more often, and then we can look to increasing the length of the pap smear screening. I hope that answered the question.
And just a follow-up on Dr. Taylor's answer, I agree with everything. And the discipline. There are persons, they come and they tell you, I'm here to do my annual pap smear. When you look in the notes, it was 5 years ago, the last one. So that is, when you tell them 1 year, they will do it 2 or 3. And if you tell them 5, they might do it at 10, right? As for the cost of HPV testing, yes, it is there, and people maybe want to find out. It's about $10,000 for HPV test, and it is done in group. And then the group will have the low risk and the high risk. And the funny thing about it, all HPV tests will come back positive for some type of HPV, but not necessarily oncogenic type. So in other words, all of us have HPV. You must use that to say, oh, not me,
I see a couple more questions in the queue. Going on the same HPV theme, what are your thoughts on male HPV testing, especially an approach to treating a couple, similar to treating fertility issues?
That's male HPV testing.
Yes. Where do you test?
Yeah, that's correct. Not sure.
Have a cervix you can smear.
Yes.
Are you going to push a swab like the COVID swab up inside the penis?
Yes. We don't know of male HPV testing at all.
You guys tell him. I just telling you what my face did.
Sorry, we're not. Yeah.
I'll jump to the next one. I'll jump to the next one. And is there any suggestions as to what we can do as clinicians and primary care physicians and specialists alike to hasten the expansion? I imagine expansion of screening across Jamaica.
Excellent idea. I can partner with the Jamaica Cancer Society, especially the trust where we're going forward now, and to have them as our partners in areas outside of Kingston and can conduct screening on our behalf. And we can use them to expand our membership base that side as well.
So in other words, you are saying these clinicians can become partners of the Cancer Society, put up our logo,
yes,
and we would refer patients to them.
Yes, yes.
And subsidize those patients where the patients can't afford to pay.
As we're doing now, yes.
My suggestion, Dr. Taylor alluded to it, is that young people like Dr. Taylor and Dr. Bambury, they should be able to get the politician and influence policy to establish national cancer screening program. Because I will tell you, I do a lot of pap smear, but what I'm doing is the same people over and over and over.
Yes.
Yes, so in 10 years, you do 10 pap smear and same person as in screening.
I agree with you, Dr. Guthrie. Next one is, while we applaud those efforts, are those considered ideal interventions for population-based screening as opposed to opportunistic screening? So in other words, it's following on what you just said, Wendell. And the answer is that we want to have population-based screening.
Yes.
When the Minister of Health is finished with his coronavirus stuff, you can tackle him on that one.
Yes.
Right now, everybody getting it wrong. You hear how much COVID-19 cases we have. Well, in fact, we are having coronavirus positive. COVID-19 people are sick.
Yes. Yes.
If you listen to morning news,
Thank you so
get it
much.
right, and listen to the evening news, and you say, "Oh, this is a father of fake news."
Back to you, moderator.
Okay, so if we have no further questions, nothing more from you, Shillian, I just want to say thanks to our organizing committee. Thanks to our Mr. Chairman, Mr. Jarrett, for making this possible, as well to our IT specialists, our panelists, the well-able Dr. Guthrie, Dr. Matthew Taylor. Thank you so much, Ms. Brown, at the level of the JCS. Thank you. Thanks to all our participants for all the questions and comments. And all of those who are in attendance, thank you so much. And we will see you next year. So just to remind you that you can pick up your CMEs at the Jamaica Cancer Society. You can go in starting next week Tuesday. If you pay for this, I think it's $1,500, Shullian, if I'm not mistaken.
You're correct, though.
Right.
You are correct.
Your CMEs. All right. Have a wonderful Sunday afternoon. Thank you.
And presenters get double the amount of hours.
Yes, yes, no.
That is the medical council regulation.
Somebody's on.
Because you have to prepare it somewhere else and come and do it another.
Thank you.
Have a good afternoon, everyone.
Bye.
Thank you. Bye-bye.
Bye.
Bye, everyone.
Bye.
Yes, keep safe.
Thank you very much.
Great.